New at 5, it's the 3rd of the month, and time for Buddy Check 3. This is when we remind you so you can remind a buddy to practice your monthly self-exam. That makes it more likely to find breast cancer in its earliest, most treatable stage. Lisa Rose joins us with the impact one organization has on the Ozarks. Lisa, and you have a big impact on the Ozarks, Lisa.
Yeah, well, through this vehicle for sure. I hope so. Thanks, Paul. Paul and I have met a lot of wonderful people in this nearly 6-year journey of Buddy Check 3. They are the breast cancer patients, their families, their doctors, and other therapists. But along the way, we realized many of those people had one particular connection in common, and that's the Breast Cancer Foundation of the Ozarks. BCFO's services range far and wide in its mission to support people and their families going through breast cancer treatment.
Life feels almost normal to Cynthia Barnett these days. Just making a sandwich can feel like a small victory after more than a year now since breast cancer changed her life.
I was just changing and I found something. And it was enough to kind of stop me in my tracks.
It was a lump that hadn't been there when Cynthia had her regular mammogram 2 years before. Within days of her discovery, she would be diagnosed with aggressive stage 3 breast cancer.
I had to start with chemo. So I did that starting in July. And then I had my first surgery in November. And then I did radiation to confirm that it's completely gone. And I had a couple other surgeries in February.
And now Cynthia is taking oral medication and regaining strength for more reconstructive surgeries.
My dad has been a rock. My kids have been rocks. We're all a Marine Corps family. So my father was in for 28 years, my ex was in for 4, and had 3, my older boys served, and I have 1 still in, and he's stationed at Camp Pendleton, California.
They are a family of fighters.
They're my life.
So Cynthia had the best kind of support. But 8 months into her battle, she hit a wall.
When you look in the mirror and you see all these scars, and you see yourself, but it's not yourself. And I was struggling.
That's when she turned to a support group at Breast Cancer Foundation of the Ozarks.
The support was immediately there. I knew I can continue. I already knew I can continue for my kids. I knew I can continue for my dad. I knew I can continue for family. But it was that moment that I needed to continue for myself.
Now, 8 months later, Cynthia is helping others in that support group and spreading the word about BCFO's many other services, ranging from support garments to financial help with bills, even mortgage payments and gas cards. Especially helpful for people like LaDonna Weathers, who lives miles away from her medical appointments.
I live 40 minutes away from my doctors, and often you are having multiple appointments a week. So that's a lot of gas. So again, a gas card just alleviates some of that financial pressure.
We're kind of a lifeline for a lot of their clients. We help make sure that they're there to see their doctors. We make sure that they don't have to worry that they have a roof over their head or lights on or food in the refrigerator. They get to focus on healing, and they get to focus on their family while they're going through their journey with a little bit of help from us.
BCFO was just the lifeline Cynthia needed.
I didn't know all the services they provided. I just knew I needed support, and they were there.
If you or someone you know would like to be part of our Buddy Check 3 program, just go to ky3.com and click on Buddy Check, and it will take you to this form that you can fill out so that you can team up with a loved one and get those self-exams done every month, and especially all of the other medical guidelines that we're talking about, such as mammograms. So, Paul, it's been a really great program, and we hope it continues.
Yeah, and this particular one, Lisa, you're talking about, it must be so helpful to talk to someone who is facing the same challenges as you are. It must make a big difference for those women.
That's what these patients say, that it has made all the difference.
All right.